Aloha guys, Dr. Tom is back. I'm coming at you once again. Yes, I'm having equipment problems today, which does not make me happy. Alright, we're studying Unit 27, Chapter 27, medications that affect the nervous system. Analgesics, that's an important term to know, are pain pills, pain relievers. And by definition, they relieve pain without loss of consciousness. Opiates, natural and synthetic drugs derived from morphine. Morphine is a very potent pain reliever because it's used by paramedics and military people, but it also is highly addictive, apparently. Examples: codeine, Dilaudid, oxycodone. We have a real problem with this nowadays. Opioids are synthetic drugs not related to morphine that mimic morphine's actions. So opiates are general ones, and opioids are synthetic ones that mimic it. Important to know. Narcotics, analgesics, again pain relievers, work on the central nervous system, may produce dependence, may cause respiratory depression, must follow controlled substances law. Antagonists, naloxone hydrochloric acid, or HCl, prevents or reverses effects of opioids. Is given by IV, subcutaneous injection, or intramuscular injection. Analgesics and antipyretics. Of course, we know an analgesic relieves pain. Antipyretics reduce fever. I guess generally speaking, if you have a mild fever, you don't want to mess with it. It's part of the healing process, but if it gets carried away, it can be very serious. Anti-inflammatory properties except acetaminophen, which is Tylenol. Tylenol reduces fever and pain, but it doesn't reduce inflammation. And that's one of the main reasons why I don't particularly like it. I prefer ibuprofen. Examples: codeine, Percocet. Percocet's pretty strong pain. Ibuprofen is an NSAID, as is acetaminophen. But they still help. If you're in a lot of pain, they probably won't make a lot of difference. But for things less than that, they work real well. Sedatives and hypnotics. Sedatives have a calming effect. Hypnotics induce sleep. Benzodiazepines or penes, commonly used to treat anxiety, reduce early wakening, increase total sleep time. Onset of action is 15 to 40 minutes. Duration 6 to 8 hours. However, there's some potential for dependence. Parkinson's disease, a serious neurological problem that has to do with basically a shortage of some of the neurotransmitters in the brain, particularly the neurotransmitter dopamine. Parkinson's disease imbalanced neurotransmitters, acetylcholine and dopamine in the brain. Palliative means it just relieves the symptoms. Of course, guys, a palliative relief is still worth a lot. Bradykinesia, slow movements. Rigidity, they move, they're rigid when they walk. They have tremors. They have a pill rolling tremor, like this. They don't say that here. For equilibrium, poor balance, examples. Okay. Alzheimer's disease, caused by deposits of amyloid plaque between the brain cells, begins after age 60. Incurable. Symptoms: mood changes, disorientation, confusion, memory loss, tendency to misplace things, impaired equilibrium or dizziness, personality changes. Treatment: cholinesterase inhibitors, antipsychotics, antidepressants. Okay. Guys, years ago when I was in school, Alzheimer's was called pre-senile dementia, because senile dementia is just the dementia that most people get if they live to be quite old. But it seems like now any dementia is Alzheimer's. So I guess they've changed. But it used to be before the age of 60, so they've changed it substantially. Anticonvulsants. Epilepsy, because most of you are probably familiar with that, is an abnormal electrical charges in the brain. The treatment objective is the greatest control of the seizure with the least side effects. And they have to give an individualized dosage. You can have partial or focal seizures. You can have generalized bilateral seizures, which are called a grand mal, M-A-L, unilateral, tegretol, clopin. Epilepsy can be really debilitating, guys. It's sad. I had a patient one time that had it. It was a lady, and she had a seizure, and we lived in the mountains of Tennessee, and she had a wood stove. And during the seizure, she rolled up against it and got her leg up against it and put a very serious burn on her leg. Anesthetics interfere with conduction of nerve impulses, produce a loss of sensation, muscle relaxation, and or loss of consciousness. A general anesthetic is where they put you to sleep. However, there's a lot of local anesthetics that are used just to control sensation in a specific area. Like lidocaine and novocaine are used extensively in doctors' offices and by dentists and stuff. You know, if you have to have some sutures put in a laceration, they usually numb it with lidocaine and then. Ophthalmic drugs used for glaucoma and mydriasis. Mydriasis, guys, is where they, when you go in to have an examination, they put those drops in your eyes to open up the pupil because they can see a lot better. It's a wondrous sight when you get in and look, but it makes it a lot better. I've never looked through one that was the pupil was dilated on, but I have the other. So anyway, table 27.8, drugs used to treat glaucoma. There are different kinds of glaucoma, guys, but remember that it's the aqueous humor is not draining properly out of the anterior chamber, and pressure builds up and damages the delicate internal structures of the eyes. And in 7-9 mydriatic agents, you're probably not going to deal with that unless you work for an ophthalmologist. However, you might still ask on test. Diagnostic examination, surgery, infection, inflammation. Drugs used in vertigo, motion sickness, and vomiting. Vertigo is used to describe the illusion of movement. Motion sickness is usually associated with travel, like seasickness or carsickness. Vomiting is usually a symptom of underlying causes. Table 27.10, drugs used in vertigo, motion sickness, and vomiting. Vomiting, guys, can become a real problem if it's extensive, because you can start dehydrating and you can start losing electrolytes like sodium ions out through the vomitus to the point where it can be very serious. Medications that affect the reproductive system. Ovaries and testes are the prime organs for sexual reproduction. Follicle-stimulating hormone, luteinizing hormone, which come from the anterior pituitary, control functions of reproduction. The ovaries in the female produce the ova, secrete estrogen and progesterone, the primary female hormones. Testes in the male produce sperm and secrete testosterone, the primary hormone in the male. Both sexes have a little of the other sex's hormones. Estrogen, primary female hormone. Excuse me, there's more than one estrogen. Problems with it can cause amenorrhea, where you stop having periods when you shouldn't. Dysfunctional uterine bleeding, which is now known as abnormal uterine bleeding. Okay, they changed the name. Hirsutism is where a female has hair growing where it shouldn't be growing, like on her chest or on her face, or like a beard. Menopause. Atrophic vaginitis, where the vaginal canal and walls start atrophying. Osteoporosis. This is a big time problem, guys, and it's associated with estrogen. Estrogen plays a role in mineral salts being deposited in the hydroxyapatite crystals of the bone. And when these fall after menopause, we start seeing a lot of it. Palliation for breast cancer. There are different kinds of breast cancers, guys, and some of them you don't want to get are dependent on hormones and make it grow. But some, I guess, it relieves it. But you got to be real careful with that. Of course, the oncologists are experts on that. Adverse reactions, breakthrough bleeding can start. If you're, for example, if a woman's in menopause and she's put on estrogen replacement, it can make you start bleeding again. It can make breast tenderness, alopecia, hair loss, usually in patches, headaches, weight gain. Progesterone, the other female hormone, uses secondary amenorrhea when you've stopped having a menstrual cycle for some other reason. Abnormal uterine bleeding, threatened or habitual miscarriages. Adverse reaction, breast tenderness. Galactorrhea means the breasts start leaking out milk when they shouldn't be. Urticaria are hives, edema, rash, acne, alopecia, baldness, again, hirsutism, growth of abnormal hair growth in the female. Pulmonary embolism, thrombophlebitis in the deep veins of the legs, bleeding, spotting, amenorrhea. Hormones, guys, are very powerful things, and they have to be used diligently. Now, there are a lot of a sizable number of ladies that when they start in menopause, they suffer terribly. They have hot flashes and a lot of other really disturbing symptoms. And you can give these ladies hormone replacement treatment, and it's very effective for these. Most effective treatment for menopausal symptoms. Short-term use of hormone therapy for relief of menopausal protects against the following conditions: osteoporosis, colorectal cancer, heart disease. Risk: pulmonary embolism, deep vein thrombosis, strokes, and gallstones. Now, guys, there's something here that's really dumb. They've left out the most dangerous symptom, potential risk of all. If a woman's on hormone replacement therapy, it absolutely raises their risk to get breast cancer. Absolutely. Doesn't mean it will, but it substantially raises the risk. It's important enough that the doctor has to sit down with these ladies and explain to them. And they have to weigh out whether their symptoms are so terrible they need to take that risk. That should be right here in big bold lettering on this slide 16, and it's not. That's well known, well documented, and has to be dealt with. My advice would be don't go on hormone therapy unless you are really hurting, because it absolutely increases the risk. Also, too, guys, there are a number of organic, natural type symptoms that red clover and some other ones that really do a good job too. I know for a fact, not because I took them, because my lady or wife at the time took them. That's another story for another day. Oral contraceptives, nearly 100% effective. Estrogen in pill form inhibits ovulation. Adverse reactions: nausea, weight gain, edema, swollen breasts. Progestin in pills inhibits secretion of luteinizing hormone, causing changes in cervical mucus, alters the endometrium, which helps prevent unwanted pregnancy. Adverse reaction: headaches, acne, fatigue. Male hormones: testosterone uses hypogonadalism when things haven't developed like they should, to stimulate puberty if it hasn't. Impotence: select breast cancer patients. Again, these hormones can have really strong effects, so you have to have an expert on that, of course, the oncologist. Adverse reactions in the male: gynecomastia, what? Little breasts growing them in. You also see it in bodybuilders sometimes that are doing a lot of steroids. Frequency, urgency, let's see, penile erection, hirsutism, excessive hair, acne, baldness in the men, normal. Hirsutism, men are already hairy, but like some bodybuilding dude who's taking testosterone might get a real heavy beard, more body hair, like, really hairy. Electrolyte imbalance, liver neoplasms. Now, does neoplasm automatically indicate cancer? No, it's not good, though. It means a tumor, and it certainly can be. Headache, anxiety, depression. Erectile dysfunction affects up to 20 million men in the United States. 80% have a physical cause. What? Something that impairs circulation, guys. Vascular disease, there it is. Or neurological disease, diabetes and things. There it is, diabetes, surgery, prescription drugs, spinal injury, substance abuse, hormonal imbalance, treatment of Agassiz levitra. Drugs used during labor and delivery: uterine stimulants, oxytocic agents, induce labor, induce abortion, control bleeding. Uterine relaxants given during labor until the fetus has had time to mature after 20 weeks of gestation. There's a lot of problems, guys, associated with a premature infant, their lungs and vision and stuff. So, okay, and that finishes this up. Dr. Tom will see you next time, and we'll continue on the rest. This is for week 4 in pharmacology class. So I'm signing off. I'll catch you next time.